Okay, picture this. It's 3 in the morning. You're jolted awake by this sharp, searing pain in your lower back. And in that quiet, dark moment, a very specific kind of fear kicks in. You know the one. It's isolating, it's confusing, and it always seems to happen when you're completely alone.
And that's when the question hits you, right? Am I just being dramatic, or is this serious? I can pretty much guarantee you that every single person who's been in this situation has asked themselves that exact same thing. It's that terrifying moment of not knowing if you're overreacting or if you're ignoring a signal your body is screaming at you. Well, let's get you some clarity on that.
Right. So let's talk about that 3 a.m. fear. The whole goal here is to cut right through the panic and get to the facts. We're going to give you the tools to know the difference between a really bad back day and a true emergency, without you having to waste your time, your money, or, frankly, your sanity. First things first, let's just take a deep breath. Let this number sink in. Fewer than 1 in 100 cases of low back pain are a true, time-sensitive emergency. That's it, less than 1%. Now, that doesn't make your pain any less real or any less awful, but it should help lower the stakes just a little bit. So you're probably thinking, okay, great, but what about my pain? It feels like an emergency. And that's fair. For that vast majority, that other 99%, that intense, frightening pain is usually a muscle strain or an irritated disc. It's absolutely miserable, I get it, but it's not life-threatening. The pain is a blaring fire alarm, for sure, but the fire is usually small and totally manageable. This reminds me of a great quote from an ER doctor to a patient who was absolutely convinced something was terribly, terribly wrong. The doctor said, "Good news, your nerves are annoyed, not dying." And that perfectly captures that feeling, right? That mix of embarrassment and just overwhelming relief when you find out your body is just really, really annoyed. Okay, so we've established that most of the time it's not a 5-alarm fire. Now let's flip the script and talk about that critical 1%. We're going to zero in on the exact, rare symptoms that make a doctor sit up and pay very close attention. These are what we call the red flags. So what is the actual emergency doctors are looking for? It's usually a condition called cauda equina syndrome. This is the big one. Think of it like a critical power cable at the base of your spine. A whole bundle of nerves is being squeezed shut. If that pressure isn't relieved quickly, the damage can be permanent. We're talking about your ability to walk and control your bladder. That's why the red flags we're about to cover are so incredibly important. So the first big category of red flags is all about your nerves. Now, we're not just talking about the typical sciatica pain shooting down one leg. Doctors get concerned when there's a sudden, noticeable weakness. Like, is your leg actually giving out from under you? Are you tripping over your own foot? And this last one is super specific, so listen up. Saddle anesthesia. That's numbness where you'd sit on a horse or a bike saddle. Your groin, your inner thighs, your buttocks. That is a huge, huge warning sign. Okay, here's a little test you can do literally right now. Try to take a few steps walking just on your heels. Then try walking a few steps up on your tiptoes. How does it feel? Compare one side to the other. If one leg suddenly can't do what it could do yesterday, that's a real signal, not just anxiety. This simple check helps separate that nagging what-if worry from a concrete physical warning. Now, I want to share a quote that was actually overheard in an ER waiting room. A man said this, and he was immediately moved to the front of the line. It's a powerful reminder of the single most urgent category of red flags, the ones that are, a little awkward to talk about, but are absolutely critical. These are, without a doubt, the loudest sirens of all. Any new, sudden change in your ability to control, to start, or even feel your bladder or your bowels is a massive red flag. This could be anything from trouble starting to pee to not feeling the urge for hours even though you've been drinking, or even a strange numbness when you wipe. These symptoms demand immediate medical attention, period. Look, let's be really clear about this. If you experience these symptoms along with your back pain, the pain itself almost becomes secondary. These are your body's most urgent signals, and they absolutely need to be heard right away. All right, the last set of red flags aren't just about your back or your nerves. They're about the bigger picture, your overall health and the context of the injury. If your back pain comes with a fever and chills, that could point to a serious spinal infection. If you have a history of cancer, or you've been on steroids for a long time, or the pain started after a major accident like a car crash, all of that changes the risk profile completely and makes the situation much more serious. Okay. So you've gone through the checklist in your head. You think you might have a red flag. Now what? Where do you actually go for help? This is where practical things like time and money come into play, and you want to make a smart call without putting your health at risk. Let's boil this all down to one simple fork in the road. It all comes down to a single question. Do you have any of the red flag symptoms we just talked about? If the answer is yes, the choice is clear. If the pain is just really, really bad, but you can walk okay, you can pee normally, and you can feel everything down there, well, then you have a few more options. So here's how it breaks down, practically speaking. The emergency room is for any red flag situation, period. Yeah, it's expensive, but safety has to be the #1 priority here. Now, for severe pain without any of those red flags, an urgent care clinic can be a great middle ground. It's way more affordable, and they can handle it. For everything else, that chronic, nagging pain, your regular doctor is your best and cheapest bet. Let your symptoms guide you first and worry about the costs second. All right, let's wrap this up by putting a powerful tool right in your hands. This is a simple checklist you can run through in less than a minute to make a confident decision right here, right now. So let's run through this together. Just answer yes or no in your head. Did this all start after a major trauma, like a car crash or a bad fall? Yes or no? Do you have a new loss of bladder or bowel control? Yes or no? What about that weird numbness in the saddle area? Is one of your legs suddenly much weaker than it was yesterday? Do you have a fever? And finally, do you have a history of cancer? Be honest with yourself.
And the rule here could not be more simple. If you answered yes to even one of those questions, your decision is made. You need to treat this as an emergency. Don't wait, don't second guess it, go get checked out, and let a medical professional make the final call.
And really, that's what this whole thing has been about. It's about learning to tell the difference between the voice of fear, which is loud and chaotic, and the clear, unmistakable signals your body sends when it truly needs help. Knowing which one to listen to, well, that can make all the difference.